Persistent pain, also commonly known as chronic pain, is pain that lasts longer than 3 months. It is something that is experienced every day and can have a major impact on a person's life. There can be the obvious causes for persistent pain, such as injury, accident, some forms of cancer, arthritis, stenosis.
It can come from your nervous system playing up. Some sort of chemical change within your body can create a chronic pain condition. In Australia, a lot of people suffer from chronic pain. It's about 1 in 5 of the population.
The hardest thing was just really accepting that one way of living came to a grinding halt in a way, and just got to the stage where I was taken over by pain, and it ended up I had to quit my job, and it ended up being 2 years before I could really get back into the workforce again.
Chronic pain is a life changer. It can restrict the activities you do, which restricts the life you live with your partner, with your family.
The pain feels like this big heavy backpack that you always got on your back all the time, and it kind of really impedes upon that sort of being in the moment with someone. Sometimes it can be so distracting, and it took me a while to come to terms with that.
A person on a persistent pain journey, it impacts on their mood state, their communication, their memory concentration.
APMA is the Australian Pain Management Association, and we're a consumer organisation providing support and advocacy for people with chronic pain. We help them by providing information on evidence-based pain management, so things that have been tested and proven within the medical community to work for pain management. We've got support groups that operate around the place. We've got our Pain Link helpline, so if you haven't got access to a support group, and we've got a Facebook page, we can talk to your partners as well and help them through the process of dealing with your chronic pain.
The best approach is a multidisciplinary pain management approach, and also an approach that the person takes an active role in their treatment plan. The multidisciplinary approach has been shown to actually help improve a person's quality of life.
I think you can resume a normal life. You just have to take the time, give yourself the time to come to terms with the big changes, which are a real jolt to start with. I feel like my life is a lot more normal than it was when things were really hectic. The routine that I have now to help manage, I walk for an hour or swim for an hour alternatively every day. I have some medication, and I get acupuncture. And at the same time, I'm sort of talking to other people or doing little bits of research to try and find the next little sort of course in maybe getting a breakthrough.
Actually having a good GP that has a holistic approach to pain management, and getting a lot of the allied health professionals on board as well as a good pharmacist and good specialists that can help you manage your condition. Certainly a person needs to have the psychosocial aspect dealt with, because the chronic pain or persistent pain condition impacts on their life massively. Also, they need to get active again, so a correct exercise regime with a physiotherapist, exercise physiologist, and then also an occupational therapist to look at the different things you may be doing in your work life and personal life.
Accepting that you've got a chronic pain condition is probably one of the hardest steps to take, but once you take that step and you accept that yes, you have a chronic pain condition and that it's going to be with you for quite some time, then at that point in time you are most likely in a position to be able to move forward. Don't give up on life. Go out there, start searching and researching. Talking to APMA can help. Talk to your medical professionals. Keep going until you find the right management technique that is going to work for you. I know what it's like to be there. I've been where you are. It is possible to make your life better, but it takes work.
If a person doesn't receive the correct help early enough, it's that isolation that feeds into the negative thought processes, the feelings of hopelessness, helplessness, the depression, anxiety, stress levels. It all has this massive flow-on effect.
There are people who can help. There's nothing shameful about it. It's if you can own your pain, you can deal with it so much better and quicker.
If you suffer from persistent pain, you're not alone. APMA can help you navigate the health system and provide self-management options. By getting support, you'll be in the driver's seat, not your pain. Contact Painlink 1300 340 357.